Hi, I'm Emily from Nebraska. My healthcare story starts the summer before my senior year of high school. I was experiencing these really odd flare-ups, and they would happen about every 8 months. My doctors had absolutely no idea what was causing my symptoms. So for every 8 months, for about 2 years, I would have to randomly go see my doctor, who would then tell me that he was really sorry, but he had absolutely no idea what was wrong with me and send me on my way. That was fine until in October of my freshman year of college, I got really sick, and I was hospitalized for over a week and a half. I missed 3 entire weeks of school, and in the following months, during the diagnosis process, I went through multiple MRIs, CAT scans, and a lovely colonoscopy. Fortunately for me, due to my team of 7+ doctors, which include a neurologist, a rheumatologist, a gastrointestinalist, and multiple other physicians, I was diagnosed with Behçet's disease, which is a really rare autoimmune condition that only about 15,000 other Americans have. Now, this all sounds like a lot, and being only 19 years old, a freshman in college, trust me, it was. But I was lucky. I was covered by my parents' health insurance. They were completely paid for. I didn't have to sit in the hospital worrying about bankrupting my parents while simultaneously trying to recover from this illness that most people don't even know exists. However, being diagnosed with a chronic illness at such a young age really limits your opportunities for employment later in life when your employment is directly linked to your health care. Upon being diagnosed with the disease, it became slowly clear to me that I was going to have to plan my life around my illness. Because when you're diagnosed with a super rare autoimmune disease that costs a lot of money, going uncovered is not an option, especially in the world of insurance when there's pre-existing conditions that can completely bar you from receiving any coverage. And for a disease like Behçet's, which affects my eyes, my nose, my mouth, my legs, my insides, I could even have problems with my brain at some point should things go terribly wrong. That's pretty much everything. And going uncovered would essentially bankrupt me. So, when last spring the Affordable Care Act passed through Congress, I was absolutely ecstatic. I really don't think words can describe to you how important and how much this has impacted my life. Now, because of the dependent care clause, I can do what I want with my life. I don't have to plan my career around where I can get health insurance or go to law school right after I graduate college just because it's the only way I can stay on my mother's insurance plan. I can do political organizing, I can do campaign stuff, which are jobs that traditionally don't have insurance benefits right off the bat. But more importantly than that, I no longer have to worry about pre-existing conditions. And I know most people understand how the old insurance system worked, where if you had a condition before you were insured, the insurance wasn't liable to cover it. And for me, that means if I had ever gone uninsured for any period of time because I'm diagnosed with a disease, I would have been screwed. So, I mean, healthcare getting passed has completely changed the way that I'm going to be able to live my life, the decisions that I'm going to make about my life, and it has made it possible for me to choose a career path that I actually passionately care about instead of having to plan around a disease that I can't control having. My name is Emily, and that's why getting cover matters to me.